Wow, we're back again. Welcome, welcome, welcome to another episode of Mind Health Matter, a place to discuss mental health as Caribbean people. Typically, I co-host this show with Kimberly Homishashek, who is a psychologist, and I am Flavia D'Souza. I'll be hosting by myself today. We're missing you, Kimberly, but she'll be back in a few weeks. Today, we're really lucky to have Dr. Kerry Ann Williams, who has specialization in child, adolescent, and adult psychiatry. She is board certified. She's the medical director at the Justice Resource Institute in Boston, Massachusetts, and has a small private practice. She really sees individuals who have a variety of psychiatric concerns, but she has very specialized experience in dealing with emotional trauma. She also hosts a show. It's a radio show based out of Boston, Massachusetts on 98.1 FM. So you can check her out there. It's called Black Mental Health Matters. It airs every single Sunday at 1 p.m. Eastern Time. Most recently, this is really impressive, Dr. Williams was named in the Boston Business Journal's 40 Under 40 for 2020. So we are really lucky to have her on air today live. And we wanted her to start by telling us a little bit more about herself, kind of just where she was born and how she ended up in the United States.
Hello. Well, thank you so much for inviting me to be on your show. I'm very happy to be here. So I'm from Jamaica. I'm from Mandeville. Grew up there, went to school, everything. I did 1 year of sixth form. And then came to the U.S. And I have two older brothers. So my brothers had to come to the U.S. first for college. Oh, wow. And so then me being the youngest of the three of us, that was kind of my path as well. My older brother went, middle brother went, and then it's like, well, you graduated from high school now. It's time to start looking at colleges overseas. And that was just the path that my parents had planned for us.
Wow. So you were the third of three.
Yes. And the only girl.
You're the only girl, you said?
Mm-hmm.
Okay. So for the viewers who are watching, what is sixth form?
Oh, so it basically, in I guess I would say kind of the British Commonwealth system, there is a slightly different path. And I liken it to like the Harry Potter series, where I think he kind of had these extra like years that you don't have in the US. And so people who have read the Harry Potter books probably would know that there's like these extra like years. And in the Jamaican system, there's like this hybrid with grades and forms. And so high school is kind of like first through fifth form. And when in the grade system, it was kind of like high school is grade 7 through grade 11. So I graduated in grade 11, which was the equivalent of fifth form. And in order for like a college preparatory kind of couple of years, we have 2 years of what they call sixth form, and where you do kind of like advanced college prep and another set of examinations. And I only did 1 year of it. Because I knew that I was going to be taking the SATs and then coming to the U.S.
So you had planned not to go back into high school, but to go straight into college when you came to the United States.
Correct. Yes. And I know some people do like 1 year of high school and all of that, but I never planned to do that.
Right. No, so we have a similar path we share a similar path because I also came to the United States after high school. I did 2 years of sixth form and then came. And, I just thought of it as a continuation of school. I was not prepared at all for all of the changes that came with being in the United States. And where I came was in the northeastern part of the United States. And I'm wondering now, after all of your training, especially the psychiatry training, the child and adolescent training, if you can look back, are you able to identify some of the challenges you faced in that immigration experience? Was it the same for you? Were you naive or were you prepared? What was that like?
So, when I first came to the U.S., I was very much, I was a person that was just always looking ahead. I was like, man, I loved being in America. I wanted to learn everything about American experience, everything. And so I think when I first came, I was so wrapped up in the idea of just going forward. I'm going to be on this pre-med track. I want to become a doctor. I'm going to just study. I was in the library until 12 o'clock every day. And I kind of like barreled through and I thought that I was doing okay. And I thought at the time, the only issue I had was maybe anxiety. You know,
Mm-hmm.
I was very anxious and I was holding a
Mm-hmm.
lot of anxiety inside.
Mm-hmm.
Now, knowing what I know now,
Mm-hmm.
I look back and I think one of the core issues that affected me and that affects a lot
Mm-hmm.
of people my age when you first immigrate is this issue of identity.
Mm-hmm.
I was
Mm-hmm.
dealing with that issue, and I didn't really know it at the time. I couldn't put those kinds of words, but basically,
Mm-hmm.
grew up in Jamaica. You know, I'm a
Mm-hmm.
Jamaican.
Mm-hmm.
That's it. That's my
Mm-hmm.
identity. I'm a Jamaican.
Yeah. Yeah.
And then
Yeah.
you come to the US, and all of a sudden, it's like, who am I now
Mm-hmm.
that I am not in Jamaica anymore? Now that I'm a
Mm-hmm.
Jamaican in another country, what does
Mm-hmm.
that mean about me? And also,
Mm-hmm.
how do other people see me? And I
Mm-hmm.
think as 17,
Mm-hmm.
introverted and socially anxious,
Mm-hmm.
I didn't like getting attention for being different.
Mm-hmm.
And so I think those are the things I kind of struggled with was anxiety and the shift in my identity that I wasn't prepared to navigate.
Mm-hmm. 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 You've said a lot of things just now. So just backtracking a little bit, did you recognize that you were anxious at the
I
time?
did. I did recognize I was
Okay.
anxious at the time.
Mm-hmm.
And I, I look back and I think, I don't know why I was so anxious. Like, I think about it like
Mm-hmm.
the age that I am now.
Mm-hmm.
I think, I don't know why I was so anxious, but I think some of it comes down to actually to some of the developmental tasks of adolescence. And for the
Mm-hmm.
listeners, one of the developmental tasks of adolescence is about fitting in, about figuring out who
Mm-hmm.
you are and fitting in with your peers.
Mm-hmm. Mm-hmm.
And when I
Mm-hmm.
was in Jamaica, I didn't feel like I had to work as hard to fit in with peers. I mean, you still have to deal with that
Right.
anywhere you
Right.
grow up.
Right.
But I felt
Right.
like I fit in as a Jamaican. But
Right.
when I came to the
Right.
US,
Right.
I had to struggle I never felt like I fit in. And that chronically feeling
Yeah.
like you don't fit in, it made me very insecure. And so I was always
Yes.
just fearful about, should I wear this? Should I do that? Oh, my hair looks different. Oh, this looks,
Yes. Yes.
it was kind of like difficult for me. I didn't have the confidence to kind of say, so what?
Yes.
I'm different.
Yes.
So what? Like I
Yes.
wasn't that person,
Mm-hmm.
you
Mm-hmm.
know?
Mm-hmm. That's so good that you just mentioned this idea of the psychological stages that we pass through. And it
Mhm.
happens at every age of life. And there's a unique psychological change. There's several unique psychological changes that stages that children pass through, and that adolescents pass through, and that adults pass through. And you very poignantly put out there that we're thinking about, we're experiencing this identity kind of transformation during that time, kind of separating from our family, figuring out who we are in the world and how we're going to move through the world. So you're struggling with identity in college. And when in your kind of journey were you able to put that language to it? Because language is so important, and helping us to understand what's going on is a critical part of our profession. So when were you able to put that language to it?
Wow, it took a long time. And I think because going back to one of the things I said earlier, I was kind of just barreling through. I had 4 years of college, 4 years of med school, 3 years of psychiatry residency, 2 years of psychiatry fellowship. And it wasn't until 2012 that I was finally finished my 13 years of training. So like,
Wow.
I didn't really have time to think about what happened in college. It wasn't until I finished my training and I actually had time to breathe. And I started to work more extensively with adolescents and with with immigrants in the clinic that I worked in, that it caused me to think about my own life. And I said, maybe some of this stuff actually I went through too.
That's so good. What are some of the other challenges that you have seen persons who come into your clinic have that you think that maybe you had as well?
Well, I think that I mentioned anxiety as one of the things that you can go through. And I think that's kind of important to go back to a little bit. There's a lot of things that can cause anxiety. So one is the idea of differences and how you handle differences and kind of how you manage that. But the other is about support. People immigrate under different circumstances. People are voluntary. People are brought here by a parent or by someone else. And some people come alone. Some people come with their family. Some people come with their spouse. And so when, people come to the clinic, it depends on kind of if they immigrated by themselves and they have no one, if they immigrated with their family. And so at least they have some of that support, but also if they're able to find a community that support them, even if they're not with their family. So these things can also kind of affect anxiety and comfort level and assimilation and all of that. The other thing people can experience sometimes, and I think I kind of experienced at times, but it wasn't really due to immigration so much. But sometimes you experience a little bit of depression just because like for me in my training, I was always working so hard. I was always just kind of like pushing it. And this idea of wanting to, maybe it is a little bit related to immigration actually, because some of it is like wanting to fulfill the reason for which you came kind of thing. Like this idea of I came all the way here, I can't fail.
Right.
So there's a little bit of pressure of like, I can't fail. And sometimes that pressure, that stress can lead to sadness and anxiety sometimes too. So I see that in people in my clinic, but I also experience that myself.
Now, we got a question actually here from the viewership and the listenership. What are some of the symptoms of anxiety? Not necessarily even in your situation, but just in general, in both, and specifically now we're thinking about adolescents. Because you came in the adolescent period, there are adolescents who may not be able to express themselves or have that language. What are some of the things that we can look out for if we're people around those adolescents?
Well, I would say one of the features of anxiety is avoidance. So this idea of I'm just going to kind of just stay by myself, I'm just going to stay in my room, or I'm going to avoid talking to people or avoid going to places, that can be rooted in insecurity and fear. So that's one thing that can indicate anxiety. The other thing is feeling like you have, or knowing that you have worries that are difficult to control. So this idea that you have a sense of like, I am worrying about something, but I can't stop myself from worrying about it, even though you know that this is probably not going to happen, or that kind of thing. So it can be difficult to control the worry. That's one thing to think about. And sometimes anxiety can show up as physical symptoms too. So you might be getting headaches more often, stomach aches, body tension, body pains, that kind of things. It can affect your appetite. Sometimes when people are anxious, they don't eat as much, or they eat more. So that can happen as well. Yeah, so those are some of the features.
Those are some good features, because I mean, basically we need to pay attention to our bodies as well as understand, because you said sometimes we worry about things, but it's really difficult to stop the worrying. And oftentimes if we meet an anxious person, or maybe there's an anxious person in our family, or we have an anxious child or adolescent, the thing that we draw on from is you need to just stop worrying. And sometimes it's just not as easy as that, especially if the worry is caused by a real external stressor that we're not getting rid of. And for some individuals, that's part and parcel of the immigration experience. So you also mentioned this word, assimilation, when you're talking about just your experience. What is your understanding of that word for the viewership?
Sure. So assimilation, when I use that word, I use it to mean how a person integrates into a new culture. And people can do that in a lot of different ways. And there's not always a right and wrong way to do it. But some people, kind of like myself, when I entered a new culture, I just immersed myself in it right away. And I just wanted to be a part of it. And then there's some people that they're really good at holding on to who they are and also integrating into the culture. And then they end up being kind of bicultural. And then there's some people that kind of marginalized. They don't integrate into the new culture. They kind of stick to their own groups, and they don't really embrace the new ways. So that, that's another way that people can kind of handle immigration. So there's a lot of different kind of circumstances for that. But assimilation, I think of it as how you integrate into a new culture.
Now, in talking about assimilation, in talking about forming identity, and talking about maybe wanting to kind of merge or to blend in, especially as an adolescent, I'm wondering, coming from a Black country, how it was for you to come to the United States and experience maybe Blackness in a different way.
Yeah, so it's something I've thought a lot about. And, one of the shifts people don't really prepare, don't really prepare children for this.
No.
Because you don't know to prepare. I mean, if you're from
Right.
Jamaica, you grew up there, you wouldn't know to prepare your child for what's going to happen.
Mhm.
But one of the shifts is
And
that
I would even go as far as, even if you are from the country and you've immigrated at an older, or if you came to the States and then maybe you went back, you would have a different kind of experience at somebody who's coming at a younger age, just because of the life stages that we're talking about.
True. And that's exactly right. It does matter the age of when the person immigrates, because they have different things that they're going to face, right? So if you're still in school, now you have to deal with peers, versus if you're in your college, maybe it's kind of unfolds differently because people are having more mature discussions about race, and then, so on. I think one of the things that I wasn't really prepared for, and I had to almost kind of just learn on my own, is this idea of this idea of Blackness and what does it mean to be Black. And, being in Jamaica, Blackness was not really, it was a fact, but it wasn't like a culture or like my identity. So I wasn't like thinking about Black culture in Jamaica. It was just Jamaican culture. And moving to the US, all of a sudden being Black was a culture. It was like a culture of itself, and people would talk about what does it mean to be Black. And one of the things that I would say I found very helpful to me, and I'll share with your listening audience, is that I found that when Black Americans use the term Black, they sometimes will interchangeably kind of use the word Black to mean Black American sometimes, and sometimes they're using it in a more general sense of international Black, but you don't realize which one they're kind of meaning. So sometimes they'll talk about, what it means to be Black, but what they really mean is what it means to be Black American. So it's almost as though there's like this word that's silent. And when they use the word Black, the word missing is American. Because being Black in Jamaica might be different. Being Black in Nigeria might be different. Being Black in, whatever else might be different. So this idea of what does it mean to be Black, the silent word missing there is what does it mean to be Black American? And whenever when I told myself that whenever Black Americans use the word Black, I need to add the silent word American to it, then a lot of things started to make sense. This idea of that identity, how people talk, what kind of music they like, how they dress, what foods they eat. And the differences with kind of like why I didn't know or do those things, it kind of made sense. People make a lot of assumptions because you look Black that I should know about things related to Black American culture. And when I didn't know them, people were confused because they kind of feel like all Black people are the same sometimes. So kind of preparing kids for what does it mean to be Black in America, and the idea of Black as a culture and not just as a skin color.
I would just in terms of my own self-disclosure, for me, I would say my racial identity formation process happened after college, when I lived in Harlem, New York, and I was surrounded by Black American culture. Before then, I had not really paid attention to race and what it meant, because race means something in a particular place and history, and so that was my learning. That was my learning space for that. And so I also kind of resonate in terms of, for me, it wasn't so much as hearing people talk about things and not understanding it, but it was almost as though there was an obliviousness to it, because I swam in a different kind of sea. I breathe a different kind of air in Jamaica, and then I came here and I was swimming in a new sea, and I had to get accustomed to the new environment. So that was my experience. Now, in terms of just kind of navigating that, when in your journey did that become relevant for you? Was it kind of a seamless thing, little by little over time, or was there a point in time where you just kind of felt struck by this difference in Blackness in Jamaica versus in the United States?
There was a time where it kind of crossed over, and I think it happened when I moved to the Northeast. So when I moved to the US initially, I was living in very less diverse spaces, kind of white spaces. And to be honest, by virtue of being in medical training, I was very commonly in white spaces, still am for the most part. But when I moved to the Northeast, I would be in more kind of Black places, like churches and things like that. And I was around more Black people, more Black Americans, but also people from other places as well.
Mm-hmm.
And that's when I started to really kind of think about the fact that I didn't know certain things. Like I didn't listen to some of the same music. I didn't get some of the references.
What a joke.
I probably shouldn't have embarrassed myself by saying some of the stuff I didn't know. But I began to realize, like, I guess, okay, I'll share a couple of things that I was kind of like, what is this? So for one, I didn't know what grits were. Like, what are grits? Like, I had no idea what grits were. I didn't know chicken and fried chicken and waffles. I didn't know that that was a thing. I was like, people eat fried chicken with waffles. I didn't, you know, these are things that you just, I'm not going to find out about some of those things in the circles that I was in. But you learn about that when you start kind of being in Black circles. Even like when people started saying things like deuces, and I was like, why is everybody saying deuces? I don't know what that means. So part of it is just my overall lameness as being primarily a student. Up until that point, like I was just studying. So I wasn't listening to certain kinds of music. It was just not my thing. I tend to, you know, listen to different things. And some of it was just a lack of exposure. So that was a part of it. But the other part that I had to do too, once I moved to the Northeast was, and this actually happened even more recently, was starting to read more about Black American history. Because I was, you know, to kind of go back to a word that you used about being oblivious, like I did not know a lot of the details about what Black Americans experienced in this country. And I think that was really, really important. And it's something I would recommend anybody immigrating to a new country is to learn
about the history of the country.
Yeah.
Right. Because you're going to be perceived through the lens of the history. Yep. So I totally agree with that. It's so critical. And I'm wondering how, we have a question here that I want to get back to from our listenership. I'm wondering how, because now you have a radio show, Black Mental Health Matters. You have your private practice. So I'm wondering how all of your kind of immigration experiences, your intense reading of the history, your training has shaped how it is that you practice, why it is that you have this show right now.
Yeah. So, you know, I guess it's a lot of things. One is definitely, you know, reading and understanding the history. It was very eye-opening. And then in addition to that, in my practice, I would have patients from a lot of different backgrounds, including Black Americans. And I would talk with, I was initially, I think my first foray into this, again, I was kind of like just, you know, pitter-pattering on my own. And then someone said, you know, someone's looking for a Black psychiatrist to give a talk on psychiatric medications. Would you mind doing that? And, you know, so I said, yeah, that's fine. I'll give a talk on psych medications if they're looking for someone Black to do it. And once I entered that realm, I started to hear more about how there was disparities in mental health and how that representation mattered. And people kept telling me, oh my gosh, you don't understand how important it is that you're Black and a psychiatrist and how that representation matters. And I was just like, really? People, you know, this is important to people. And I started to learn more and more about that. And people kept telling me, you know, this could be really helpful for people to know, like you could make a difference by you know, talking to people in the Black community, teaching them about mental health, teaching them the things that are important and teaching them about the disparities and all of that. And so I thought about it a lot and I started reading about it. And I said, you know, this is actually really important. And these are my people. I want to be able to share this information. I want to increase mental health literacy among my own people because we shouldn't be disproportionately suffering and we shouldn't be disproportionately lacking in knowledge in this area. So that's part of what kind of led up to me kind of then having this show in addition to all of that.
Yeah, that's inspiring and so powerful, your passion. And that you said, my people.
Yeah.
So you came from a place where it was, you know, me
versus them.
We were with them, we came, and now we're embracing our community in a more holistic way. And I think that's a really powerful thing. Now, just kind of circling back around, you had mentioned two, and this is getting to a question that we're getting here. You had mentioned two kinds of symptoms that people experience, well, maybe even you experienced during your training. Very common, you know, feeling anxious. A part of that was being in a new culture, trying to integrate, blending in as an adolescent, but also the depression that came with focusing really hard on your academics, maybe even a little bit of burnout. What does depression look like and feel like based on either your experiences or your experiences that you've heard of from your patients?
Right. Well, I guess I'll just kind of combine it. So, some of this might be my experience, some of this might be a patient experience, but just in general, what depression can look like. So one thing depression can look like is actually chronic tiredness. And it's a bit deceptive because it feels like it's just a physical symptom. But feeling tired, even when you've had enough rest, even when you've gotten sleep and you've gotten good sleep for a while, you're eating or whatever, and you're still just chronically tired, that could be a sign of depression. But also not being able to sleep well. So having poor sleep or disrupted sleep patterns, that can be a sign that your body's off, that you're just stressed. And sometimes, like for me, one of the things that whenever I'm like either tense or upset, I can't eat. And so, eating less is sometimes a sign that, again, your body's just off. Something is off. And then there's other people that do more kind of emotional eating. They'll eat carbs and junk food, and they kind of like will end up gaining weight. So, and you notice all of these things yet haven't even mentioned mood, right?
Yeah.
They're all physical.
You haven't mentioned sadness. You haven't mentioned, you've mentioned what's happening in the body.
Yeah, because sometimes you experience sadness and sometimes it just comes out in other ways. But with sadness, we can find it kind of looking sometimes like even a little bit of like numbness, like kind of I don't feel anything. I'm just going through the motions. It can even look like starting to question if you're doing the right thing. Like, is this really what I wanted to do? I'm not enjoying it as much as I used to. So that can happen as well. Feeling very negative. Depression is something that tends to tell us a lot of negative thoughts that come along with depression. So if you find yourself being stuck in a lot of negativity, really thinking, oh, I'm probably going to fail this, or, that kind of thing, that kind of negative stance can be a sign of depression as well. And the other thing I'll just mention about depression in general is that just having one of these things by themselves doesn't mean you're depressed. Often depression is a collection of things. So if you find that there's kind of a lot of different things going on, then maybe it could mean that you're becoming depressed. So those are some
right. And I mean, if it's affecting your life, it's affecting your relationships, it may be time to seek out kind of an objective third party in the form of a counselor or a psychologist or social worker, psychotherapist, psychiatrist to really do an evaluation. Now, you mentioned these symptoms of depression. Are they the same in adolescents? An adolescent that is immigrating, undergoing stress, maybe experiencing anxiety. Talk about anxiety earlier. What about depressive symptoms? Is it same in adolescents and adults? Are we looking for other kinds of things?
It can be. But one of the other things that we sometimes see that people can misinterpret is irritability and grumpiness. And so people they don't see it as sadness or depression. They kind of see it in a very negative light. Like, why are you talking to me like this? Why are you acting like this? So you may have a teenager, and maybe a family that immigrates together, and the teen is in school, and all of a sudden they get really snippy and they seem like they have an attitude. And it's because they're under stress and they're actually feeling very unhappy. And it's not because they're trying to be rude to you or anything like that or disrespectful, but they're actually struggling with something and they don't know how to talk about it. And they end up being really irritable and mouthy and kind of having an attitude. So that can be something that can actually be depression, and it doesn't look like sadness. But the other thing to think about too is when people are feeling sad or discouraged, they sometimes socially isolate. So if you have a teenager that you would normally be social, like they're not introverted like me, they would normally be social, and you suddenly find that they don't want to leave their room or they don't want to talk to anybody. They're not going anywhere. They don't even want to go out with you sometimes to places. Maybe that they're starting to kind of slump into a depression, because it does tend to make people want to just hibernate almost.
I do have a comment to say about irritability, because I work on an inpatient unit. So I work with pretty ill individuals, people who are coming in for crisis, really need a lot of additional support and need to spend a little bit of time in the hospital, and then they can get back into the community to live their life as they choose to. And the transformation that I see over a few days is really quite amazing. But oftentimes on day one or day two, depending on the situation, there's a high level of irritability. And just because the person is grumpy with me, maybe short, maybe challenging to have a conversation on day one, does not mean that's going to be the same on day 5.
Yeah.
So it does not mean that this is the person's personality. Like you just said, it could be a sign of something else that's more serious and that's manifesting. Yeah. Now, we are, the time always just runs off so quickly. And so there are just a few things. We look out for these symptoms in our adolescents and our teens that might be experiencing immigration. Immigration can be a stressful experience, like we said before. Assimilation is happening and different people assimilate in different ways. Some people may integrate fully, some people may maintain their 2 different cultures. I'm mixing up the terms, which is why we need Dr. Mishashek to come back and explain it to us, because this is her area of expertise. However, the one last thing that I kind of want to hit on before we end is, if we're noticing these things, I mean, imagine you're a new person coming into the country, you're not aware of resources. Where can you look to for help? Where can you look to for assistance? That's just a general resource, maybe, whether it's a family or an individual.
Wow. So I think if you have family members that are good listeners, but just so it can be so variable amongst families, then it'd be great to start with talking to somebody that you know and kind of say, hey, what do you think about this? If you're in college, there might be some college like campus resources. There's usually some kind of campus resource with even just like a general counselor that you can kind of talk to, and usually they will. Mental health services are big these days, so they'll tell you, they'll probably get that in your pamphlet when during Welcome Week. You'll probably get information about mental health services. If you're not in college, if you're like in school, high school, so on, as a guidance counselor, you probably can meet with and ask for help. And then beyond those years, hopefully, if you can get connected with a primary care physician or general practitioner, that can be a gateway person to getting you connected to talk to somebody. Otherwise, if you're an adult and you're looking for services, sometimes you can just go to a website like Psychology Today, which covers the entire country. Just plug in your zip code and look for a therapist. It all depends on like where you want to start. And so a good place to start is like a primary care provider or just whatever's closest by to you, just to find out, what do you really need?
Those are great tips. Thank you so much. Now, how can we find you?
So you can go to my website. I have a couple of websites. So there's Kerry Ann Williams MD.com, and that's the website for my private practice. And so you can just go to the contact me page to send me a message. But you can also go to the website for my radio show, which is Kerry Ann, it's drkerryann.net. And so drkerryann.net is the radio show website. You can also contact me there too. It'll all get to me. Yeah, so drkerryann.net. And then we can also find out, you can watch past shows and all that stuff. So I hope you check out that website. Yeah. Yeah,
we will all be checking it out. Thank you so much for joining us today. For another Mind Health Matter. We're on every first and third Wednesday at 7:30 p.m. Eastern Standard Time live. Usually on Facebook. We've had some glitches recently, but we're usually on Facebook and YouTube on Island Fever FM radio station. Tell us what you want to hear about on the show by leaving comments or by messaging us on Twitter at Dr. Homi Shashek and Dr. Flavia D'Souza. Until next time, your Mind Health Matters.